views, opinions, and content of this show are those of the host, guest, and callers. They do not necessarily reflect those of Local Matters Broadcasting, LLC, its owners, partners, affiliates, assigns, or heirs. Having said that, it's now time to say good morning, St. Johns County. Welcome to the weekly radio show of the St. Johns County Council on Aging, better known in our community as the COA. We are your local nonprofit agency who for the past 51 years has been leading and advocating for the dignity and independence of seniors and responding to their changing needs. I'm Brian Robinson, Program Director for COA, broadcasting to you live from the studio of WFOI 102.1 FM, your local radio station for news, sports, and talk. Before we get into our show, let me remind everyone that if you have a question, a comment, or a suggestion, or if you just want to tell me how great my fashion choices are, you can send your email to radio@coasjc.org. Again, that's radio@coasjc.org. And if you have a question during the show this morning, feel free to jump on your email and send that question in, and we will try to work it into our show. Joining me in the studio this morning is Dr. Adrian Long. Dr. Long is from this area and is a graduate from the University of North Florida. He is board certified in family medicine and finished his residency in Rome, Georgia in 2011. He and his wife started Crescent Beach Care in 2013, which is located at 6573 A1A, St. Augustine, Florida, which is better known as Crescent Beach area. And he has been my primary care physician since 2018. I'm honored to have him join us this morning. Welcome, Dr. Long.
Thank you. Pleasure being here.
Good to have you. So the primary demographic of our listeners for the show this morning is those who are 60 years of age or older. So my questions are going to be geared towards those who are in this demographic. But before we jump into those questions, if you would, take a few minutes to tell our audience about yourself and about the types of services that you provide at Crescent Beach Care.
Well, thanks for having me this morning. I know it's a nice hot one for today.
It has been very hot.
Yes, it has.
Before the show, I was telling you I was on my run yesterday after work, and I was like, "Oh my gosh, why am I torturing myself?"
Well, you get your sauna when you're running.
Yeah, I was like drenched in sweat.
Yes. Oh, you said a lot at the beginning of the preface of this of what we're about and where I am from. We are enjoying practicing in this area for almost 13 years now in July. So we had a previous job where I was working at Hastings for a little while, which helped out the area tremendously. Mm-hmm. But my wife and I are here with our two boys, 12 and 10, Sebastian and Nicholas, at surf camp today. So they're staying nice and cool.
That's fun.
Yes, definitely loving the beach. They're definitely beach boys. Mm-hmm. But yeah, we're just known to this area. My wife's actually from Iceland, so she's been accommodating herself for the last 13, 14 years to Florida's weather, so she's doing well.
And I was going to try to pronounce your wife's last name.
Yes.
And I was like, I'm not even going to try.
She goes by Dr. Thor, so it's really Thorhaus Deuter. So, and in Iceland, they take their dad's first name and put a daughter or son next at the end of it, and that's their last name, so it's pretty interesting. But
that is interesting.
Yeah, all of our patients call her Dr. Thor, so I'm sure they get intimidated by seeing Dr. Thor for the first time, thinking this big, Viking guy, but it's this little frail lady, super nice, very, very knowledgeable. But we both are enjoying the area, practicing for the community, and outreaching for anybody who's in need for services for the area.
Yeah, and so Crescent Beach Care is also, if I remember correctly, it's also a walk-in clinic.
It is. We first started as a walk-in clinic primary care to help the area with urgent needs. We do have 3 other doctors, 2 nurse practitioners, and a physician's assistant that kind of incorporate most of the walk-in stuff. My wife and I have a lot of routine patients now that were booked out for a long time, so we try to incorporate an urgent appointment for our patients. But if we've got a lot of vacationers down in Crescent Beach, St. Augustine area that tend to get ill or injured or any of those possibilities, so we can try to accommodate them as soon as possible to get them healthy and enjoy the beach again.
Yeah, and a fun little fact. So I first moved to St. Augustine in 2018, and I was working for a company called the Focus Group. And at the time, the office was located right next door to
Correct.
your location.
Yes.
And then one day our boss says, "Oh, I sold the building," and which happened to be to you.
Right. It was nice. We acquired that building, which was very good, which they actually remodeled the whole building, and I was like, yeah, at first I tried to buy it before they acquired it too, but they got on it quicker than I did. But they remodeled the whole building for me, which was great, and I just had to change some colors to some doors, but it was a perfect lead way to expand our practice.
Yeah, and so now when I come to see you, what used to be my office is now one of your exam rooms.
Correct.
And I saw you, I think last week, and then I came out, and then I was like, oh, which way do I go? And you would think I would have known how to get out of that building because I worked in it for
that was a little joke
couple
after you
years.
left too. I was like, he used to work here, and he's still lost in his own office. So.
Yeah. So, anyways, but so I remember when I first moved here, and I was just kind of asking around some of the folks that worked with me, who do you go to see? What who do you recommend? And we had somebody that was on staff there, and she recommended you. And I was like, boy, that's convenient because it's right next door. So if I have a doctor's appointment, I just have to walk right across the parking lot to be able to see you. So, and it has, in my opinion, has been one of the best decisions of my life to come see you.
That's what we like to hear, man.
Yeah. And so we'll jump into a little bit more questions that we have for you, for our listeners. But before we do that, we're going to go ahead. We're going to take our first break at the moment. And so you are listening to the weekly radio show of the St. Johns County Council on Aging. And hopefully the commercials are going to kick in. All right, we're just going to keep talking until they kick in, because usually when I hit that button, the commercials come on. So, all right, so let's just go ahead. We'll jump into this next question, and then we might just get interrupted. But I wanted to do a little bit of research for the show, and so I jumped onto what's called the American Academy of Family Physicians website, aafp.org, and I read an article on the importance of having a geriatric assessment. So my question to you is that something you do? So if somebody comes to you, let's say they're 60 or older, right, and they're in that, what we would define as that geriatric phase of their life, right?
I like to call it seasoned.
Seasons, yes, very good. Okay, so is that something you do? So what I'm going to do before you answer that question is I'm going to hit the button again. Now we can take our commercial break. So we'll come back and have you answer that question right after these messages. And when you hear the Ramones, you're listening to the weekly radio show of the St. Johns County Council on Aging here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined this morning by Dr. Adrian Long of Crescent Beach Care, who also is my own doctor. And I'm not your only patient. So you have lots of patients. But all right, prior to the commercial, I was asking you about what the American Academy of Family Physicians website talks about having a geriatric assessment. So if somebody 60 years or older comes to see you for the very first time, is that something you do or something similar?
Yeah, we tend to incorporate that into a visit for them. We call it, especially if they're in the Medicare stages, it's a Medicare wellness, which incorporates a lot of different factors. There's more of a risk assessment associated with their care. Once they get into Medicare standards and of that seasoned life, I'd like to say, they tend to expect a physical exam for their wellnesses. That's what they geared up for all their life. When they come in and do a Medicare wellness, I mean, typically we don't have to really touch them. It's more of a, like I said, a risk assessment. We do multiple questions to determine if their life is up to speed with their years, and then also formulate plans to incorporate their well-being throughout the next year. Medicare states that they come into the office other times throughout the year to do all the other stuff that this information that we're gathering for this visit, Medicare Wellness, helps to identify risks that they might be associated with, and or kind of organizes their care with providers that they see all in one visit, advance directives, whether or not they're mentally, physically capable of being by themselves. So yes, there's those aspects that we do for a visit for them.
And so if somebody comes in that has dementia, right? Because we we serve individuals through COA that are dealing with dementia. That probably makes it a little bit more challenging, right?
It does. You have to hopefully have help from around their life as far as a caregiver and or resources to better fit them for keeping up with their own care. That's the biggest thing with someone with dementia is are they capable of day-to-day activities, events directed living, ADLs that we call it, but that's a huge factor.
Yeah. And so another thing that I wanted to talk about this morning is the preventative actions, because we're constantly being told, do this, don't do that, and so forth. So as we think about the age demographic that we're looking at, 60 and older, what preventative actions should they be consistently taking to ensure that they stay healthy?
That's a wide question right there. So, I mean, obviously it's all individualized. The general one that obviously we see in Florida is sunscreen and hydration. Those are key factors. I mean, obviously living at the beach, we have a lot of patients who are very active and fit for what they do for their seasoned life or age. But hydration is the key. People think they hydrate enough. What I always tell my patients is they hydrate enough to maintain their dehydration. So to get enough fluids in your body it's a job. It's work. I mean, it's not like you're sitting there sipping on water all day, but you have to make a conscious effort of staying hydrated, But then obviously, as we get seasoned in life, your skin has taken a toll if you've lived in Florida your whole life. And as you get up in the years, it tends to thin out and get frail, and then that's where the hydration helps out with the moisture of your skin. But then wearing sun protection clothes or sunscreen, those two key features are one of the preventative factors to obviously coming to your doctors to make sure that everything's aligned. Got a lot of patients who are super healthy in their 70s, 80s, still running marathons, and they come once a year. I mean, obviously they're keeping up with their preventive maintenance, make sure that good diet, hydration, plenty of exercise. Those are other two key factors of preventive care, I guess you could say, is diet and exercise.
And then there's things that that we're constantly told don't do, right? But yet people still do them, right? So, for instance, smoking, that I mean, I've been hearing that all my life, right? So that's been but yet it's something that is still part of our society.
It is.
My dad started smoking when he was 15, ended up dying of lung cancer at 71.
Yes.
Now, of course, and when he started at 15, I mean, the things that we know now, they didn't know then, right? So it was, they didn't think that it would have the implications that it ended up having, right? But today we know a whole lot more than we did back then, and so, but yet it is something that people still continue to struggle with.
And that actually leads into not only coming to the doctors when you get into the 60s and older, but starting all the way back in a child standpoint and doing your routine evaluations throughout the years, because kids start to tend to experiment more in their teens, and then it leads into their 20s that they continue with some bad habits, and that's where if they come routinely, we can start educating them more and more. Hey, let's not do that. So by the time it gets to their 60s and above, it's maybe they've learned a lesson, or we can help them throughout the years to try to stop smoking. It's trying to get somebody to stop smoking is the hardest thing to do. I mean, I always rate it as number one, stop smoking. Number two is alcohol. Number three is drugs or illegal substances. Smoking is everywhere. It's in any store, every corner. I mean, you can just go, and most of the time kids are 15, 16 buying cigarettes because they look old enough. And or now they're doing all these vapes, which is even more detrimental. So, because we don't have enough knowledge yet of what it's going to cause down the road. It's you're burning a substance into your lungs. So, that's another 5, 10, 15 years. We'll start to see the ramifications from that.
Another preventative measure. What about routine blood work? I know I like to come see you like once every 6 months, and you do blood work. Is that something that you typically do with all your patients, or recommend for all your patients?
Oh, absolutely. And they say anywhere past 18 years of age with family history of anything, doing some routine blood work, and then starting to dial in on disease processes related to the patient and or family history as well, and then try to do that on a yearly basis to keep up with anything. I mean, a lot of things can change within 2-3 months, so yearly is a nice start to see a trend. And then obviously if anything starts to alter, you can start to dive a little bit deeper to modify the labs according to those modifications.
And one of the things that I absolutely love is, so you use Quest Diagnostics.
Correct.
And, I have the app, and so I can go on, like they'll notify me when my blood work is completed and they've done all the testing and everything, and then I can go on and I can see the results before I even come to see you. And I love that exists today, right, in this day and age of technology that we live in, because then I can go in and kind of be prepared before I come to see you and say, hey, I'm a little bit concerned about this. So, for example, my glucose is always a little bit high, right? It shouldn't be any more than 100, and mine's usually like 105, 106, somewhere around there. But my A1C,
which is a 3-month test of your sugar average, which is better test.
Yeah, so mine is usually like 5.4, and I think the danger zone is what, 5.6?
5.7 is where they start to flag it. 6 is where we start to say, hey, we're starting to have some problem processing your sugars, and then 6.5 is the diagnosis of diabetes.
Okay, and that would be type 2 diabetes,
correct?
Right?
Or 1, depending on age and situation. We're starting to see type 1s, which is usually a younger diagnosis. We're starting to see some in their 30s, 40s, and 50s being diagnosed with type 1.
Yeah.
So,
and then that brings me to another statement, and that is don't self-diagnose yourself, right? Because when I look at the blood work and I see that glucose, I'm like, oh my gosh, like, and that particular one that I just did, I had like fasted like 15 hours because my blood work appointment wasn't until like noon, so it was like
probably had a cortisol response to
and I'm
help
like,
that
why
out.
is my glucose so high? But then my A1C was okay, right? Which you pointed out to me when I came to see you. So it's important that when you look at this stuff, that you need to make sure that you're talking to your medical professional to get a better understanding of it.
And back to the Quest app is a great tool to help better prepare yourself for your visit, and that's what we always employ and try to prevent for our patients. Hey, be prepared when you come see us. We're seeing you for 5-10 minutes every 6 months. I don't know what questions you have in your brain, but if you come prepared, write down some questions and go over your labs, try to understand them. Don't self-diagnose yourself, please. It's good to have some options available for understanding it, but I always like my prepared patients because it makes my job and visit with you a lot more satisfying and streamlined. Not only with your Quest app, but our system we use integrates Quest and LabCorp into our system, and you can have access to your patient portal, and that has all the labs there too. Once I review them, sign off, they're available for you through our system too. And then you can message me through there, which is another tool to use, but use that sparingly too, because I like to save it for your visit, so it's more one-on-one.
Right. Yeah, and I try to keep that in mind. Like every once in a while, I'll send you a question through that portal, but I'm trying to be, like, I don't want to send you like 50 gazillion questions because I know you're very busy, right? You got a lot of patients that you're dealing with.
You get a Cliff Note version back. So
yeah,
one-liner.
But I appreciate that that's available, right? Yes. And then another thing that I really appreciate about when I come to see you is the fact that you will take your time and let me ask the question.
100%.
Right? Like I'll come prepared with some questions, and you'll take time with me to answer those. And I have never felt like you were trying to get me out of the room, right?
No.
And I realize that you have other patients to see and so forth. But I've always appreciated the fact.
Yeah, you're welcome. That's our main goal, is to do quality of care, not quantity. When you do into quantity care, which we've had those jobs before, it's not satisfying. It feels like you're pumping them out.
Yeah, all right. That music means it's time for our next break. We'll be right back after these messages. And welcome back to the weekly radio show of the St. Johns County Council on Aging here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA. And let me just let you know that next week in the studio, we'll have COA's Executive Director, Becky Yanni, will be our guest in the studio. So tune in next week, same place, same time, right here on WFOY 102.1 FM, your local radio station for news, sports, and talk. But in the studio with me this morning is Dr. Adrian Long from Crescent Beach Care. And prior to the commercial break, we were talking about coming prepared for your office visit when they come to see you. And so that leads me into my next question, which is, I'm sure it's probably frustrating, right, when you have a patient who doesn't follow your treatment plan or advice. I'm wondering, in your opinion,
Yes.
who is the model patient? Like, who is the person that you like when you see that person on the list of patients that you're seeing? You're like,
It's
yes!
you. It's you, man. Come on. It's always you. I mean, you could be a spokesman for our model patient. You've come a long way from the day you stepped in. But no, it's somebody who's prepared, someone who's ready to take action on their health. You know, we get a lot of people that come in. Yeah, I'm ready to do this, this, and this. You send a lab order out, send whatever's required out. Follow back up in 6 months and nothing's done and nothing's completed. Oh yeah, I'm trying to do this. I'm trying. Okay, let's try it again. And you know, you try to be as patient as you can. Trying to become a doctor is patience enough. So you've spent your whole life and career to get to this point. You gotta help guide the patients who need guidance, obviously. But it's be prepared. Look over your labs. Have those questions ready. Have next steps ready too. Hey, if I change this and this, what kind of outcome am I going to expect? So you're looking at a secondary, tertiary viewpoint as well as not just now. So try to think ahead, and that helps us guide where you're at and where you want to be.
So I'm thinking that the word patience, right, probably came from a doctor, right? Because
Correct.
you have to be patient with your patients, right?
You do, and ourselves too. I mean, that's why they call it a practice of medicine. I tell my patients every day, I'm practicing every day. One day I'll get good at it, and they like the soft humor, but it's just, as everything evolves, when we go back to the beginning of let's say 10 years ago, what has changed in medicine now it seems like almost every year to 2 years, we're getting new drugs, new ways to pick up diseases, new tests, new this. So you're always evolving with the time. So you're always practicing.
Yeah. So that leads me to another question then. How much time do you have to spend keeping up on the changes?
It's an evolving look on your education for whatever field you're in. We have our board certification is used to do a test every 7 years, and if you did questions throughout the 7 years, you can extend it for another 3 years, so you get 10-year certification. I just had completed my 10 years, and now they have an evolving tests where you do questions every quarter. So you do 25 questions every quarter, plus your other questions to keep up with your board certification status to help you achieve newer stuff. That's our learning, and then obviously we have to do CMEs, which is education credits that you have to go either to a live course or online course to satisfy per year for your state certification and board certification. So you have a lot of continuing education stuff that you're doing to keep up with it. And obviously, what I always like to do, I have drug reps come in on Tuesdays and Thursdays to help, or just anybody, a physical therapist or lab people, to help educate my office and my providers and ourselves what's out there, what's new, what's coming, and it helps more education for us to understand what we need to do.
Because it's constantly changing.
Always is. Every day. Every day.
And then I would think that along those lines, something that you learned maybe 15 years ago on how to do something, maybe that is different, like a different approach.
Yes.
Today.
Every day. Every day is a new approach. Stuff that you thought you were really on top of the edge with it, and then even that sometimes I learn from my patients. Say, I went to go see this specialist and they did this procedure. You're like, okay, and then afterwards you go research it real quick and like, oh wow, and that's what they're doing now, because you learn from patients themselves too.
So the model patient, would the model patient be somebody that comes in that says to you, I was researching on WebMD XYZ, or does that, or are you like, oh, please don't do that?
Well, I always try to applaud for what they do, because you don't want to make them feel like they haven't done anything or it was a not credible source. But you said, hey, some of that stuff you can just edit yourself and it sounds real, but you got to make sure what you're reading is credible. One time we got out of residency, it was back in 2011, I read an article that when you try to Google something medical, that it's about 50% accurate. So we know which sites to go to research it and get the latest and greatest, but to the average person, anything sounds great. And the biggest thing I always hear, I was researching this and I got cancer. I'm like, no, you don't have cancer. let's go over the facts here, So you help direct them in an area and try to give them sites that we kind of look at too to get their information. But the ideal patient, like I said, I applaud them to bring their questions in, do their homework, get their labs under control. And hey, that's my first question on the lab review. Have you looked at your labs? Oh yeah, this is what I see. Let's just go over the stuff that's abnormal. I was like, well, yeah, we can incorporate the abnormals with the normals. So then, okay, that sounds better. So it gives them a better idea.
Yeah, because there's so much stuff on the internet that's not correct, right?
100%.
And I think, one of the things that I've tried to do is if I'm, maybe researching a symptom that I have, right? And maybe it's in preparation to come to see you, but I might look for like a medical journal,
correct?
Right, because that's something that's well researched, it's peer reviewed, right? And so it's going to be way better than some article that some journalist wrote, right?
Yeah. It is true. I mean, obviously the journals are a good source, but a lot of the medical journals put me to sleep. I'm sure.
Yes, yeah.
There's a lot of terminology that is in there that we understand, but then you're doing half the time trying to research the terminology because you don't know what that means, every other word, or So it is better. But the AFP.org is a great one. That's our certification that we belong to. Then they do put it in layman's terms, and that's what I tend to try to teach when patients come in is, hey, they don't have the medical degree. Let's go ahead and put it in layman's terms, and then that helps them out tremendously because everything in medicine has enough vowels and syllables in it to get you tongue-tied.
Yeah, anything with more than like 3 syllables to it or whatever. I'm like, oh gosh, I can't even pronounce that word. Right? Yeah. But yeah, so AAFP.org. I was on there for a while, just kind of preparing for our show today, and it does have a lot of great articles, and like you said, they're in layman's term, make it a lot easier to understand. So, all right, well, we're about to go to our next commercial break, and when we come back, I have another great question that we'll jump into for the last part of our show. And you are listening to the weekly radio show, the St. Johns County Council on Aging. There's my music. All right, we'll be right back after these messages. And welcome back to the final segment of the weekly radio show of the St. Johns County Council on Aging here on WFIY 102.1 FM. Your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined in the studio this morning by Dr. Adrian Long of Crescent Beach Care. So my next question for you is I wanted to take some time and focus on mental health. So when I started seeing you in 2018, I was on 3 different medications for depression. I weighed around 240 pounds. Now I'm 6'3", so 240 pounds for me.
Good football player.
Yeah, it doesn't look that bad as somebody that's 6'3", but I was still overweight. So I come to see you, and you took a different approach to my depression. You looked at my vitamin levels. My vitamin D was very low. My vitamin B12 was very low. So you recommended that I started taking some vitamin supplements, and not just anything off the shelf. You recommended a particular one. Then, the typical recommendations, lose weight, exercise. And then you slowly weaned me off my antidepressants. So I took your advice. I lost 50 pounds.
Congratulations.
And I have felt great now for the past 5 years, both mentally and physically. So now I realize this approach may not work for everyone, right? So I don't want to make that type of statement that because it worked for me, it's going to work for everybody out there that's dealing with, a mental health issue and has to be on, medication for depression and things like that. So I'm by no means trying to say that is the case. But it does reveal a correlation between mental health and physical health. And so basically, if you're mentally healthy, it can impact your physical health and vice versa.
Absolutely.
And so I was wondering if you would just take some time and elaborate more on this topic.
Yeah, so I mean, it's the one-size-fits-all approach, which we try to not do because everybody's so individualized. If we have a very ideal patient like yourself and who's in tune with wanting to get healthier and better with their life, we try to specialize their approach to that. There's a lot of good research coming out lately, especially through the COVID era, about vitamin D levels. My wife and I were heavily trained on supplementing vitamin D from our residency time frame where our training was, and we always had an approach to increase vitamin D levels to a certain level because they have been linked to depression, diabetes, dementia. We're finding out a lot of new studies coming out that they're correlated with a lot of different other disease processes. So we've always tried to target those D levels in a higher level along with their B12 levels as well. B12 is a neurological vitamin that helps out with sleep, mood, aches and pains, just overall well-being as well. And there's different formulations of B12 that come out too, and that's more of a genetic look that we deal with our vitamins that you talked about called pure encapsulation. It has to deal with metabolism of certain vitamins, and we look at genetic studies to determine that. But if somebody's really intrigued and really aggressive with their health and want to get better, we try to look at that aspect of their life and saying, hey, are we getting depleted? Here in Florida, believe it or not, we have a wider range of patients that are low or deficient with vitamin D, believe it or not. You think that D, you get most of the D from the sun, but we tend to cover up or sunscreen or any of that nature, sun hats, to avoid too much sun, which inhibits our absorption of D. So we do supplement a lot of patients in Florida for vitamin D, but it does help out with just mood. And once your mood is stable, you start to physically feel better. So then you're more likely to go exercise, and once you start exercising, you start to say, hey, let's change my diet, which is a whole cascade effect to start getting you feeling better. Then it's not it's a mental, physical, and a spiritual thing too. So it's a whole inside and outside look of yourself, and it's interesting to watch these patients grow and change throughout the years, because it's gratifying. That's what we spend our whole career into doing, is helping people out.
Yeah, and one of the other things that I did was we did the DNA test part.
Yes, that's the genetic side that we're talking about.
Yeah, and so then I got this, I don't know,
elaborate,
like
50 pages.
50-page report that basically said, okay, these are the type of foods that you should include in your diet.
Yep.
These are the foods that you should stay away from.
Right. Inflammatory marker foods.
And so that's a very interesting approach as well.
Yeah, so the whole factor is, your whole, medical concerns start with your diet or anything that goes in your mouth. Your gut absorption is key to well-being, so trying to incorporate foods like that, even if you don't do the genetic study for various reasons out there. There's a Whole30 diet that you can do. It's a book that you can read, and it's a 30-day elimination diet, and you can follow that to a T, and it helps eliminate foods that might be inflammatory for you, and then you never knew, you thought they were good for you, but you start eliminating that stuff and slowly introducing them back after 30 days, and you can see what just basically blows you up from eating.
Yeah, and it was a game changer for me. I mean, when I look at pictures of myself today, and compared to pictures of myself like 10 years ago,
it's amazing.
I mean, it's different. Like it looks like I've aged backwards.
Sure,
a little bit.
Now,
if I grew my hair out, because I shave my head now, but if I grew my hair out, it's all gray, right? So maybe the pictures would be, I wouldn't be saying that, but no, when and even my wife has said that, and my kids have said that, they're like, you look younger,
right?
When we look at older pictures from just 10 years ago.
Well, you've opened up your whole persona to life because you feel better, and that's the whole mental, physical, and spiritual side of it too. And then it's just going to help you from the years to decades from here on out too. A lot of times when we, if we need our mental health medications, which some people do, which is fine, but you have to look at, weight gain and then all the disease processes that are associated with weight gain and worry about those for the next decades. That's kind of hard too. But for you've changed it for the rest of your life, which is outstanding.
Yeah, and I'm trying to keep up with it. I'm trying.
It's hard. It's work.
It is. We were talking off air. At one point, I got down to 185. I'm now at like 195. But to maintain that 185 weight, that was hard. That was commitment. Right. Like that was like staying away from carbs completely. Mm-hmm. And I like to have a beer every once in a while. So
sure.
I wasn't having any alcohol at all. It's hard to maintain that. That weight, but 195, I'm staying there, and I'm 6'3", so I mean, I think that's a good weight for my height. So, we got a few minutes left. One of the things I wanted to ask you, maybe there's somebody out there listening right now, maybe they're a young person, and they are interested in pursuing a career in family medicine, what advice would you give him or her that you wish someone had given you?
That's a good question. Obviously, dedication to do this process is key, because it's a long process. It's a grueling process, but you eventually get there, because sometimes you feel you never get there, but it's rewarding. And always remember that it's for the love of what you do and not the pay. So,
yeah, and I would think that it's also a calling.
it is a calling.
Yeah,
Yeah.
because you don't have your typical 9-to-5 type job.
No, that's out the window.
Yeah.
In residency, from your intern year, which is your first year, we were doing 120, 140 hours a week.
Wow.
Yeah, and you're only logging 80, but you were just working a lot.
Yeah.
And it's just, but you that's where you learn, that's where you pick up. And I always tell people, at the end of the year, you're so mentally sharp but physically drained, you can just rattle anything off in your sleep almost, and still kind of carry on, but you still remember those days. But it's like I said, dedication. It's something that you dedicate your life to do, and then everything else falls into place.
We do have time for one last question, and that is an advance directive. How important do you feel that is for folks to have?
Very important. And then back to our Medicare wellness, is we make sure that that's up to date every year. So because in medicine, anything can happen at any time, and then if you're unresponsive and your family doesn't know what you do, that's where that comes into play. Advance directives help identify what your wishes are if you're in the state of nonverbal or communication with your family. Helps the team in the hospital, helps your providers, helps everybody know what your best wishes are. So yeah, we go over that every year in our Medicare wellness.
And is that something that they need to see an attorney for, or?
They can. There's all these online places that you can do them as well. But yeah, I recommend an attorney, especially if you have a lot of affairs that are associated with it. So yeah, get everything organized with a advance directive and living will. So.
All right, we got a little bit of time left. Of new patients, are you taking any?
Absolutely. We always are taking new patients. We have, like I said, 8 providers, so we're always having the door open for y'all. We are, located, down in Crescent Beach. That's near the 206 bridge that comes over to A1A. So we are on top of that. I always like to tell the patients, after you get done with our visit, you can go hang out on the beach for a little bit and go exercise.
Exactly.
Yeah.
Well, the interesting thing, as we said at the start of the show, that your one building used to be my office building, and in the bathroom there's a shower, and so one of the things I used to do is before work I would go early, and sometimes I would take a jog on the beach, and I would go and I'd take a shower, and so when I went to see you recently, and I had to use the bathroom, I was like, oh, I took a shower.
I remember that.
So, all right, well, Dr. Long, thank you so much for taking time out of your very busy schedule to be here.
It was awesome.
All right, everybody, we'll see you next week with Executive Director Becky Yanni will be our guest. Have a great week, everybody.